think we have a nice transition now because we talked a lot about the problems in China, problems with healthcare delivery systems, and now we need to look at new models and we need to look at new solutions and new programs and new ways and cost-effective ways of delivering these programs. And who better to talk about that, to address those issues, is Bill Ruh. Bill Ruh is the Vice President for Systems Technology Group at Cisco Systems. And we've been working with Bill and his group now for almost 6 months, I believe, looking at ways that we can improve our delivery of educational systems. And we're really excited now about some of the things that we are going to try to be doing with the delivery of cost-effective, scalable interventions. Bill is a techie person. I am not a tech person, so I'm going to read this to you, and maybe he can translate it for us, so he can tell me exactly what he does. But his team is responsible for vertical solutions, such as sports and entertainment, stadium vision, healthcare, health presence, service exchange, virtual service exchange, energy, smart grids, education, and IA, intelligent automation. I don't know exactly what all of those mean. I have some sense of what they mean. But Bill is going to talk to us now about transformational technology trends, the Internet of Things.
Thank you. Thank you so much, Paul. Well, it's a real pleasure to be here, and I thank Dr. Johnson and Dr. Palmer for inviting me to have this discussion with this very impressive group of people. All of them know more about healthcare than I will ever know, but I do know a few things about technology. And you know, when I listen to Dr. Lee and Dr. Tarns, and especially as Dr. Tarns talked about the need for change, and I think that idea of change is very important. And at Cisco, we spent a lot of time looking at what are some of the key trends that are fundamentally going to change things. And you know, if you look today and you said, you know, how many people buy records in this audience, and if you decide to get in the record business today, it would obviously be a very good idea to decide to go make and sell records, because nobody other than a very few select people buy records anymore. So the real question is what technologies and what's happening out in the world today that is going to fundamentally change, because the decisions we make about these programs, if we're not careful and we look backwards, we will make investments that will fundamentally not produce the results we expect. And that is a critical aspect of what are we going to do about these chronic diseases. How do people want to interact with their healthcare providers? And given it's all behavioral, how are they going to change their behaviors? And what do we need to do about it? So I want to lay out a couple of what we think are two fundamental key transformational changes taking place out in the world today. And then I'll translate to what I think are the implications. And, you know, I apologize if people don't know Wayne Gretzky, but Wayne Gretzky was once considered probably arguably the greatest hockey player of all time. And he said, when asked why he was such a good hockey player, he said, and what did he do that was different? He says, I skate to where the puck is going to be. And that's essentially what this is about. So I'll try to tell you where I think some key transformational changes are taking place, and then what I think might be where the puck will be. And hopefully that'll give you something to think about and challenge you as you move forward with your endeavors. And there are two major shifts that we really think are transformational today. The first shift is that there is a fundamental transformation in the geographic movement of people caused by social economic conditions today. And I'm going to show you some interesting data that says that people around the globe are moving, and Dr. Lee actually talked about the urbanization within China. And I will say, China does nothing in a small way, everything's done in a big way, but the fact is around the world we see those changes taking place in many emerging and developing countries. The second thing is that connectivity is becoming a part of human nature. And that connectivity has huge implications. Let me say, I know you can go around the world, and there's two things I found that I've never found someone who couldn't identify two things. Everybody in the world knows what a cell phone looks like, and what it does, and how to use it if you give it to them. It's an amazing kind of thing. And the second thing, you all know what a $100 bill looks like, I've discovered. You show someone a $100 bill, I'm guaranteed they know exactly what that is. The second thing is connectivity changes, are that people are used to that connectivity. So let's talk first about the social economic changes. And I think this quote from a UN study really does translate into the fundamental things that are going to happen globally. And that is, more than ever before, cities are home to humanity's greatest expectations. People move there because of the social economic opportunities that are provided to them. And that change, you'll see, is accelerating globally. But they're also home to increasing social disparities, poverty, pollution, waste, environmental problems. Much of that has huge healthcare implications. By the way, think of chronic care. If you wanted, there is a tie between, as people move into cities, the fact is, and we'll talk more about this, a lot of the chronic care problems are brought along behind the behaviors that brings along with it. So as a result, you can see that we're going to see an acceleration as people move into cities more and more. But it's more than just people moving into cities. There are some really fascinating events occurring worldwide. First of all, today, and this is unique, there's more than 100 cities in planning or being built in China, Chongqing, in Korea, Songdo, to house 1 million or more residents, as we see today. That's built from scratch. When I first heard this, I said, that can't be. Who sits down and says, I'm going to build a city for 1 million people? But it is going on in emerging and developing countries. Not here in the U.S. We don't sit and say, okay, let's put a new city in Nebraska, 1 million people, build it, and they will come. But it is happening in developing worlds because they don't have the cities and people want to move in. And when they do have cities, they're highly congested. They can't take on more. So they're looking for ways to allow people to give them what they want. We also see the movement to an industrial-based society. Most importantly, we are at a unique opportunity in the world today that will be gone in 20 years. It'll be totally gone. And the question is, are we going to use that money wisely or not? Because there are trillions and trillions of dollars that are going in the world today in stimulus packages. And this opportunity is we will either use that investment wisely and set the tone for the right kinds of behaviors and things and opportunities, or we will waste it. And this will be very interesting looking back 20 years. We will not see this stimulus happen again, I believe, in our lifetimes. And then we see just movement of 60% of people be urbanized in the next, by 2030, 50% today. It's accelerating. If you go back to 1900, the number was more like 10%. So we see people moving into cities. Over the next 100 years, this will get closer to 80%. And that's 500 million new people urbanized alone in the next 5 years. That's two USs being urbanized in 5 years. It's an incredible shift. Now the technology shift is also happening, and I know you can't read these, but I'll give you just a feeling for what's happening from a connectivity perspective. By the way, there's good things in connectivity and bad things in connectivity. What's happening in connectivity? When you start to look at the flow of information, the flow of information is increasing at an exponential rate. In fact, by 2013, what this says is that there's going to be 64 exabytes per month of information moved around. Now, if you look at that in terms of DVDs, it's like 12 billion DVDs a month being moved around. It's more information. Actually, the amount of information is more than all the books by far that's ever been written, all the papers and everything else. The second major trend, and this one's important, is video. That yellow line on there is the video. What we're seeing is that video is going to grow to dominate the internet in the next 5 years. People like to see video. They love it. YouTube's popular, right? But two-way video is going to change the way we do things. For the older people that today, Skype, For people in college, they all use Skype. It's free. They can see each other. My wife talks to my daughters in college on Skype. She walks around with the PC, with the video showing her, you know, what's going on in the house, you know. But that is not unusual behavior these days. Connected devices. We all think of PCs as the only thing that are connected. PCs are the lowest number of things connected on the internet even today. And in the next few years, there'll hardly be any PCs that are connected to the internet. But the number of devices are going to be more than 1 trillion devices on the internet by 2013. There's already, if you look at these numbers, about 5 devices on the internet for every person in the world today. Now, we don't all obviously have 5 PCs, but we'll talk about what that means because it fundamentally is going to change things. And then applications, we used to all think all we needed was Microsoft Office. Well, guess what? You know, there used to be a feeling there would only be 5 applications anybody'd use. Well, that has changed. In fact, these numbers are already off the charts. We had said there'd be 1.5 million applications by 2013. There's over 1 million today. If you just look at what's happening with the iPhone, it's just it's moved off the charts. But security threats are going up. I don't want to underplay that because this is probably the biggest threat to the ability to connect. And the mobile experience is going to be the experience people want. So these are the changes that are going on. Now the question is, what's all this mean? It means that it's fundamentally going to impact the future of work, life, and computing. And I won't talk much about the computing because it's probably not the technology you care all that much about. But work is changing. The idea of intercompany collaboration, look at this. This is about intercompany collaboration. That's what is the movement. It used to be that everything was collaborating in your organization, talking to people, touching them face to face. The movement is away. Those companies, those organizations that think in ways of intercompany collaboration are going to be the ones that are going to lead us in the future. Why? That's what the people who are entering the workforce do naturally. They do it without being told. They're expecting it. They think that's the way we all should act. They are comfortable with talking to more people than, you know, if you look at the time when I was growing up, the number of people you actually communicated with, if you drew a chart, was very small. As you look at it, it's almost 10 times in terms of how many people, younger people are communicating with on a daily or weekly basis. So people are more comfortable reaching out, talking, not having to see you and touch you and feel you, to be able to feel that they're connected to you. Clusters of experts. I want to talk about education. I won't go into this, but education is fundamentally going to change the next 10 years. We were having a little bit of a discussion earlier about this. You know, 1 in 6 students in the U.S. Are taking their college courses online. That's an incredible number. Who will graduate with their degrees online and very comfortable with it. If you think about it, as you go online, as you can touch more people, there is a theory that says that some educators are going to be like movie stars or rock stars. And because they will have a broader audience to reach out to, they will become people that people want to be taught by. Content and ownership of content is going to change. You just don't go to a class. And you're going to want to go to a class taught by the movie star. These things will change our whole educational experience anywhere, anytime. Connected life, you know, the pervasive internet mobility, we'll talk about the meaning of that. But, you know, in all of the work change is about productivity. Productivity, 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 if you look at that. It's about making us more productive, allowing us to produce more, and that's going to change GDPs, by the way. If you can't be a productive society, your GDP is going to go like this. If you can, your GDP will go like that. Connected life, interestingly enough, people are maximizing their productivity. It's a different way. Lifestyle optimization is going on today. People want to focus on what they want to do. They want to make sure if what they like to do is X, that's what they want to be connected to. If those are the kind of people they want to talk to, that's what they're going to want to do. They want to optimize their life around these things. And it's different globally, by the way. Culturally, everything, depending on what culture you're from, will be dependent on what your optimization is. As an example of this, one interesting thing is we're working in Songdo, and we're putting two-way video in every unit, home unit, which we thought we'd add healthcare and two-way healthcare and concierge services, etc. So we did a study that asked the residents that are moving in what would be the #1 and #2 services. I was really shocked at the #1, and we're working with someone to do this. It was karaoke. They all wanted two-way karaoke in their home so they could get online and sing. And they're willing to pay more for that than they're willing to pay for healthcare. It's a really kind of interesting phenomenon. But that's lifestyle optimization. Second one was education. Tutoring at home. They want their kids to be tutored at home. Guess what the problem is? They got to drive their kids in congestion to be tutored. You give them the ability to have an hour more of tutoring, keep them out of the car, they will pay big money toward it. Now, every country, every society is going to be different, but that's what I mean about lifestyle optimization. And then computing, I just want to say this idea of energy and sensors is all changing. Green is becoming important, and this idea of a smart grid, which we don't have time to really cover, is going to be important. But sensors, everything is going to be connected. Everything we have here be connected and be able to talk on the internet and become smart. And so there is an opportunity, I just lay out, that the internet is changing, and we're entering a new phase where lots of new companies will come out and make a lot of money. The first phase was the business phase. Everybody would have a .com page up, right? That people thought was the end-all be-all, but it wasn't. Actually, we are just now really leaving what we would call the consumer phase. That's where Facebook and all these applications changed the way people lived and played on the internet. And the reason, it's not that those will go away, it's just that the maturity level is already there with a lot of these applications. What we see now is the movement to the industrial phase, and this will be the next 10 years. And this means that everything, cars, buildings, hospitals, schools, government, are all getting connected onto the internet. And so in smart grid, for example, your electrical system, your ability to be anywhere, anytime with your cell phone and turn the air conditioning on, air conditioning off, that is existing today. Smart meters are being put in already for you to be able to manage all the devices in your home. Well, the fact is everything in your home is going to be connected. The newest refrigerators, your refrigerator does not have to stay on all the time. It's closed. The fact is the cold's in there. It's one of the worst energy usage devices in a home. In fact, if you give the utilities the ability to turn it on and off, because they have to manage to the peak, fundamentally we could save something like 30 to 40% if they could turn your refrigerator off for a minute or two when they chose. Now lots of people they get scared about that, but the fact is that this would create lower peaks, and we could fundamentally reduce the cost of consumption and reduce pollution in a big way. So these are the kinds of things we're going to see, and I'm going to talk about what this means to healthcare, because that's why we're here. But we could talk about any industry, because I'll tell you, education is going to we see it fundamentally shifting as well based on this. But if you look, these we think are the 4 key trends, and I think this goes back to how behaviors start to get adjusted, how we deal with chronic problems. You've got anywhere, anytime. Access is the issue, and we're seeing a change, and by the way, a willingness to change. Those same students who are looking at Skype, they can barely see each other, it's all fuzzy, they're having a good time on it. They're very comfortable talking to people that way. They're going to be very comfortable talking to physicians and nurses. And while there are many cases where a physical appointment is necessary, there's a lot of cases where it's not necessary to be able to get quality health care. And if you look, we're working in India. If you look at villages in India, people don't ever see a doctor. So just giving them access to a doctor this way is a fundamental step up. Continuous monitoring. Remember all those devices on the internet? We're seeing that today. What we're seeing is at home devices. It's incredible the number of home healthcare devices that are coming out. The ability to monitor at home and send that data back so someone can be notified of a change in your blood pressure, your sugar levels, your weight, can fundamentally allow an intervention to occur at the most appropriate time. Right now, interventions are scheduled. They're not based on events. The future is basing it on events and getting it out of the ability of focusing on scheduling. We're working with one interesting manufacturer. Device goes under the bed. It tells you if you've moved. So they can tell if a chronic care patient who's bedridden has turned over. And then they can call and say, you need to turn over. And these small things become things that improve the quality of life. I don't know if that's the best, use of it, but I thought it was quite fascinating to be able to do that. If all this stuff is behavioral based, if we need to change behaviors, the way you change behaviors is not by giving them a pamphlet to read and say, go do this. It's communities of interest. We change our behaviors based on who we interact with and how we interact. And it's not our families, because in many cases our families can become barriers. Because if you have to change your eating habits and your family won't, you will not make 2 meals. I think we all know that. So if you don't have someone, and by the way, why does Weight Watchers work? Is because there's someone there always pushing you and supporting you, and this idea of community interest will be important. And education and intervention, real time, the ability to connect is going to be an important aspect. All of this is enabled today, we see, through a lot of the technology, but it says then these are going to be the basis for the kinds of programs we need to build to really make a change. And in fact, we believe so much we're making big investments. I have to thank Dr. Johnson because he got us introduced, actually it's the other way around. Dr. Molina here, we are working with him in this telemedicine. His organization is really, I think, one of the leaders we've seen. He actually introduced me to Dr. Johnson, and I'm really thankful for that. That has been quite helpful. And I think, in working with organizations like Dr. Molina's, you can see that we're only at the beginning of this. And there's a lot to be learned. But we know there's going to be a clinical experience, and there's going to be a home experience. And there are going to be experiences in between. And that we're going to be interacting through these ways with video, with social networking, with interventions. The class, I think, the class act. Think about the class act and home delivery. How are we really going to do that? Do we really want to have a nurse drive around to every home at a certain time and see that person? Is that necessary? Or is there a better way to start to think about how we can take a nurse and make them more productive? Can we put the technology on a television on a home, make it on a remote control, not a computer? Because I'll tell you, if you start to look, we're going to see computers as we know them are going away. Look at the iPad, 1 million sold in 1 month. I think the kinds of devices we use will not look like they look today in the next 10 years. And your television will, or they already have internet connections, will be a way we interact. So when you start to think about the home, that home experience we believe is fundamentally important to chronic care delivery, access, reducing costs, and changing the way we live and work. But we've also got to remember that's got to come back in the clinical environment, because it's not there, there's nobody at the other end to talk to. And we think that we start to look at the future, the idea of a cloud. You plug in, and you go to iStore, and I'll leave this as the final piece. If you think you go to the iStore, everybody's used to that. You want to the iStore, you want to turn your iPhone into a flashlight. There's an app for that. You can use your iPhone as a flashlight. And that's a true state. That is a true application on there. The idea that in the network that you can create the same in the medical world, we think is coming. To where when you plug in, there's an app for pandemic management on a global basis. So the idea that you can interconnect globally and deal with things. And I want to go back to Mexico. The country shut down because of no ability to connect, and we've worked with them to rethink how you have continuity of government in a pandemic, where everybody has to stay home. The government doesn't have to stop operating. So the ability to plug in, get access to that is important. So as we look at it, we see the internet will have applications to do chronic care and mental health and training, and the ability to schedule an emergency response, and these things will exist and be plugged into, and we'll have a lot of intercommunication. Because we will never really be able to deal with the chronic care crisis that's going to come. And that's why I believe this technology is so important to where we're going to go. So with that, I'd say, it does strike me as interesting that we're here, all these people, and I will bet there's 100 times more people who would like to have heard Dr. Lee this morning. And our ability to rethink how we do these And I'll challenge Andy, next time, I'd like to make sure, that we do an interactive one where we can bring anybody in the world and they can listen in, or maybe we can even do this with video where they can see it. That would allow us to create that inner community experience in a way and start to connect in new and different ways. So I want to thank you for your time and attention. Hopefully this was interesting and thought-provoking for you. And Paul, I'll turn it back to you.